Today we're going to revisit an old subject of mine, which is lips, but I'm going to do it from a different vantage point. In the past, we've always talked about lips within the context of the lips themselves. Specifically, how does the upper lip match the lower lip? How does the upper lip have shape? How does the lower lip have shape? How does the upper lip relate to the nose and the teeth? But we're looking at very local geography. What I want to do today is to talk about a new concept I've had, which is age-appropriate lips. I really have become more and more enamored with the idea that the lip must match the face. And this is very, very important of understanding how that happens. It's much more than the idea that we talked about in other videos about balance. It actually has to do with age. And the reason I thought about this is I spent, in the last 2 weeks alone, an hour for each patient talking them out of a lip. And I started to realize I need to put this into a video format because it wasn't well explained, or really something that in my own thinking has become more mature. Here's how it started. I work with some college-age students that come in for spring break or summer. They want their lips looking better. And I can actually be a little bit more aggressive with them on their lip augmentation compared to someone 35 or even 27. It's not that a 27-year-old is old, it's that a 27-year-old has a different facial shape than a 22-year-old, and a 22-year-old has a different facial shape than a 16-year-old. Now, I don't really work with a lot of patients that young, but college-age students, early 20s, really they can tolerate a much fuller upper lip so long as the upper lip has shape, we talked about, and balance. That same lip on someone 45 would look not appropriate. It would not look right. Even if I went through all the rejuvenation for the 45-year-old, at the end of the day, that 45-year-old still looks like a more youthful version of herself, but she doesn't look 22. So I don't want to bring her back to 22 and create these lips that don't look appropriate. Her mannerisms or behaviors won't match her lips. So the lips have to look age appropriate. So what I do in my strategy is when a patient is in their early 20s, late teens, mid-20s, I tend to only use temporary products like Juvederm or Restylane. That way I can be more aggressive with the lips, still look natural, and at the same time I can also give them time to psychologically mature about their lips and before I consider a permanent filler. When I'm working with someone in their late 20s and beyond and they're psychologically mature, I can work with some things like silicone microdroplets and create a more conservative lip profile. The reason even someone in their late 20s and early 30s is buttressed against their aging, you say, well, if a lip looks appropriate for someone in the late 20s, early 30s, what will that lip look like by the time they hit 40 or 45? And here's a big difference. The lip will continue to thin. That's the nature of aging. And so what the difference is that there's a built-in safety valve, which is the idea that as I put a very conservative lip augmentation in someone late 20s, early 30s, or mid-30s, that lip will continue to thin, and that little bit of augmentation will then diminish age appropriately. And then at that point, I can consider whether to do some more lip augmentation. There's a lady that came in a couple weeks ago that had really beautiful lips, and I had done her lips in 2007, and she had aged a little bit further, and she wanted to have more lip augmentation. I said, honestly, your lips are just about right, but the goal is to say, you know what, it would look so much more better actually if I framed back the face, and I haven't done her face yet, to make the face even make the lips look even more attractive, because if I actually push the lips harder, it would make the lips look unnatural. So I really want to be careful when I'm creating judgment calls for you to make sure that the lips are age appropriate. So when you're a 35, 45-year-old person coming in wanting the Brazilian model look at 18 to 22 and bringing in some photo of a woman that looks great with really large lips, it looks great for her, and I always wondered why. Why does it look so good in her and it won't look so good in you? It's due to her age. It's not much more than facial shape, ethnicity, and other things. It's age-appropriate lips for the face. So please remember that when you come in for lips, you first have to exercise a fundamental thing, which is artistry, before you decide whether to do the lips or not with me. And I'm going to be a little bit more conservative with you because I can design beautiful lips that, in my opinion, are the most fundamental thing, which is age-appropriate.